was happening was the rise in, anti-Asian racism because of, how the administration painted COVID.
And so we saw our patients go underground. They were afraid to leave their homes. We were getting reports of attacks on our patients and our community members and even on our staff. As so much was happening and everything was resource poor, everyone was scrambling to get PPEs. Testing was really hard to access. What we saw was that our communities were invisible. And if anything, they were both blamed and yet ignored for services that they needed to get, like testing. We received funding to start up the first testing site. And what differentiated us was that we set it in a park in Chinatown where it was very visible and outdoors in the community, that it was the first Asian multilingual site. So when people came there, they could actually get tested in language. To date, we provided over 30,000 vaccinations to all communities, including the Chinese, the Vietnamese, the Korean, all the different Asian languages, as well as other ethnic groups that felt like comfortable coming to us. When we read about, Asians are so highly vaccinated, or these groups are, it wasn't done just because people just came to the vaccination sites. It was because of all the hard work that was done on the ground, that we saw the barriers. Us and community-based organizations saw that our communities were just left out, and we did the hard work that sometimes were not highlighted, that people didn't just show up to the vaccination sites or testing sites. They had to be brought there. And it was really the commitment and dedication of people who didn't want their communities left out and to die. And I think that kind of work needs to be lifted up, that it's not just the fact that we just all knew to go get vaccinated. It took so much sweat and tears from our dedicated staff who showed up every single day, on the front lines to ensure that their communities were served.